Hi, I'm Dr. Ramsey, and welcome back. Today, I want to share something with you that came to me in black and white. It's something I've known for years, and I've shared with you for years. But I just wanted to read it to you because it's still happening. And what I'm talking about is how a lot of doctors who don't study my specialty believe what I do is risky. And that would be like me thinking that when I refer patients to specialists, that they're risky, and I don't. I don't know what they do, and I couldn't do what they do, and I refer them because I know they need help. So the reason I wrote my book that will be coming out later this year is to educate people, to really inspire people to be able to become their best self. The hardest thing for me is knowing there's not a lot of doctors who provide this yet, but I know it's coming, so I'm seeing it. I'm seeing it. So one of my patients went to her primary care doctor, and she told her she was on her estradiol and progesterone. That's all, very low dosage. She's not on the high doses like I am, and I've been on for 20 years. And her doctor gave her a warning letter. So I'm gonna read to you the first part of the letter is what women go through with menopause, and the backside are cautions about taking hormones. So it's very confusing to me about what they would do. Actually, I know what they would do. They give antidepressants so that women don't know how bad they feel. That's my interpretation. Okay, so it says symptoms of menopause. So this is a majority of women. They're saying 50 to 82% have hot flashes that can be unbearable in 20% of women. And so antidepressants don't treat hot flashes. So then here, there's this woman who's distressed. She's crying, she's sweating, she's holding her head, she's holding her heart, and all these symptoms surround her: hot flashes, sleep problems, mood changes, irritability, depression, memory challenges, headaches, joint pain, weight gain, muscle loss, bladder control challenges, bladder infections, and vaginal health and sexual strain. So that we see this every day. We see this all the time. This is the reason that women come to us is because they don't want to suffer. So I'm going to share now what the cautions are. I'm not sure how other doctors treat all of these things because honestly, all of these things are treated by hormones, not a pill for insomnia, a pill for mood changes, a pill for memory, a pill for headaches, a pill for joint pain, a pill for weight gain, right? Hormones do this all. Warnings and contraindications for hormone therapy. And for me, hormone therapy is the estradiol that we lose and progesterone. I'm going to talk about just those two for women right now to keep it simple. So the cautions are a history of a blood clot. There's no study that shows bioidentical estradiol has ever caused a blood clot in any woman to date. Yes, synthetic estrogen does, but there's a difference in how these hormones work on our receptors and influence our DNA. Established heart disease. If there is one thing you can do to prevent heart disease, it's oral estradiol. It reduces it so much. And I don't want to go through the mechanism. We've done that in the past, but the best thing we can do for heart disease is give oral estradiol to women who turn menopausal. Every single year, their risks reduce for heart disease. And one study showed over 10 years, the reduction kept going down the longer they were on it. Hyperlipidemia, high cholesterol, right? Estradiol and other hormones improve lipid profiles. Diabetes. Does diabetes get worse or better when women hit menopause? Migraines. Two hormones that really treat migraines is progesterone, reduce migraines, I would say, is progesterone and testosterone, not in all women, but in most. Estrogen dependent cancer. So if a woman has an active breast cancer, I do not give her estrogen. Once she is treated, the cancer is no longer there. I would not hesitate to give her estradiol. I have had zero recurrences of breast cancer in my women who've had breast cancer in the past on hormones. I have not had a recurrence. And yesterday, I wanted to share this beautiful woman comes in. She had breast cancer in 2011. It's 2025 now. For all these years, she's been told that hormones are not something she can take. So let me share. We've talked about this before too. Her breast cancer was estrogen and progesterone positive, the very best breast cancer a woman can get if she's going to. That does not mean that these hormones cause breast cancer. Cancer is DNA damage. Estradiol is the innocent bystander. It's the fuel for cells. If there's cancer, yes, it will grow. But if there's not, it's going to make that cell stronger and stronger and stronger. Women who take estradiol have a much lower risk of breast cancer than women who don't in menopause. I've seen this for almost 30 years now. Okay. Unexplained vaginal bleeding. That's because it's not balanced with progesterone, estradiol, right? Yes, estradiol can cause bleeding if progesterone levels are not high enough. Absolutely. That's true in every single woman. Severe active liver disease, we don't treat. I can't comment on that, but the liver needs hormones just like every cell of our body. Our patients who have elevated liver enzymes do not get worse with hormones at all, ever. And then uncontrolled heart disease and cerebrovascular, brain disease, right? So I've already shared we reduce heart disease with estradiol. Cerebrovascular disease is part of the vascular system. It doesn't say it here, but cardiovascular disease precedes Alzheimer's, which is also significantly reduced with estradiol. So when conventional doctors give this out to patients, they're scaring them. Thankful my patients have such confidence in what I do with them, such confidence in what they choose to do with me, because they feel their best, they're vibrant, their symptoms of aging go down, their expression of diseases goes down. And guess what? The world is starting to catch on slowly. So thank you for trusting us here at Revitalize Functional Medicine. We always do our best to help patients, and we are extremely grateful that we have this opportunity. See you soon.